Medical Dilemma.
Welcome back to Medical Dilemma. Before we resume, I'd like to thank our major sponsor again, St. Clair's Medical Center, located at 1838 Dian Street, Palanan, Makati. Affordable, quality health care. Now, to continue our discussion, Father Jerry, I'd like to go back to your point earlier where you said that an aesthetic procedure or maybe a plastic surgery procedure could be justified if it will lend to the psychological well-being of a patient.
Right, I agree with that. As I've said in the first guideline is that bodily or psychic functions can never be sacrificed unless it is for the well-being or for the whole functioning, complete functioning of the whole person. When, for example, a person who develops that inferiority complex, let's say pango, no?
Okay.
And people keep teasing her or him that socially he wants to be away from these people. So socially,
or maybe be more acceptable.
to be more acceptable. So
society.
socially, well, she is disadvantaged. Remember that social element in the life of a person is part of his personality. When you talk about well-being of the person, you're not only talking about his own personal, individual self, but also the social. So in case of that, well, I may be liberal, but some people may not agree with me. That if you have a flat nose, and you think that it is now affecting you, and that you cannot even work because if there are many competitors, let's say applicants for that matter, usually the companies here in the Philippines, for example, they would choose those who are rather
more attractive
or pleasant looking, etc. And here you are, you have the same or even better aptitudes or qualifications, but companies would like to say, I would rather choose the other one because he's more pleasant, more attractive. Here you are, you can do the work that others can also do.
Even better.
I would go for that.
Okay.
See, you can do it. And another one, for example, if you are a flight stewardess, there are requirements about weight.
Yes.
Okay? And you have some
Extra fat
excess
there.
fats.
That
Just
liposuction
go
will
lipo.
probably.
Go for the lipo.
Okay.
Rather than lose. And that is part of your social and economic life.
Okay, but
You want to be, okay, just because you have overweight, you cannot work, and that you just stay at home.
Because nobody wants to hire you, no?
Because you're already overweight.
can we not
Yeah,
use the same
physical
argument to justify an extreme case, like the one you mentioned earlier, where the woman had herself made to look like a tiger, just to have
always
peace of mind with the husband?
Necessity.
It depends also, Father, I think, on your intention. What is the reason why you want to
That's
change
right.
yourself?
We go now to the issue. Necessity, vanity, or insanity.
So where do we
Necessity,
draw the
which means that
lines?
to the two guidelines, no? You cannot sacrifice it is for the well-being and for the preservation of life. This is necessity.
Okay.
Okay? Second, vanity. It is an obsessive attitude of a person to want to be beautiful in order to be admired. That is vanity. You do everything just to be admired. Okay? Small,
Flat-chested.
flat-chested. No. To whom do you want? Or to whom?
Do you want
what
to
would
be attractive
To be attractive. You want people to, magandang balls, etc. Or your husband, etc. Or your husband is demanding, you have a very small boobs. I'm going to leave you. Why? Did he marry you just because of you, or is it because of your boobs? Small boobs. So let's try to be clear about this, no? And that one who went for a tiger look.
Yes.
Because the husband seems not to be attracted to her. But she did not probably even ask the husband,
Yeah.
will I look beautiful
To you.
to you, and would you have more time to me? So what is the motive there? Why is like that? No. That's not any more vanity. That's insanity.
Right.
And
Okay,
I
well-
would even say inanity.
What's inanity? Father, what's that?
What's inanity is no sense of wisdom, no sense of understanding.
Okay.
Nonsense.
Nonsense.
Can I?
People would argue that you know, this is my body. You know, can I not
I
do
can do
anything I
whatever
would
I
like to do with my body?
Okay?
Yeah.
If that is the case, if that is your principle, can I just do anything, any tattoo, put here, put there, put there?
Which
Some
people are
actually
doing now,
do.
People are
Father.
doing that.
They're doing now.
Not knowing that from the very beginning, it's not your body. You're just a steward of your body that is owned by the Creator. That's one of the things that you have to realize. It's not yours. As a matter of fact, you live in and out. You don't have control whether or not that body is going to be alive still tomorrow or not. It's the Creator's control.
Oh. You know, I have a little joke, Father, that I am
Go ahead,
sure that
Doctora.
you wouldn't mind because
Go
it has
ahead,
to do
let's
with
see.
it has to do with God, but no disrespect for Him. Speaking of Vanity, you know, we have this socialite. You know, the socialite, paayos ng paayos, but she's very good on earth. She has been donating lots of things, doing charity work, doing missions, etc. And so when it was time for her to go to heaven, there was Saint Peter there, and then she was not accepted. No, there was the Saint. There was a list
recognize
there.
anymore?
Inuna mo naman ako, Father.
Okay.
Yes, and then there was this voice a male voice, apparently from God, and sabi, Father, God, why did you do this? I mean, I've done so much on earth. Why? Ay, sorry, iha, sorry, kasi I did not recognize you na.
I think, okay. Oh.
Okay.
Well, there's nothing wrong with trying to enhance oneself. There's nothing wrong making oneself more pleasant. But the excessiveness sometimes leads into vanity.
So, Father, where do you draw the line when you say
Yes,
it's an
that's
excessive
actually my
for
same
vanity?
question.
Because once a person starts to do something like pangong ilong, they want to do the nose,
Then
and
the
after
eyes.
which, the eye
The
starts
eyes,
to
the
droop,
eye
they
bags,
need to do
you
that.
want to take them out.
And then, apparently, when they wear their dress, especially when you work in Makati and
All right.
this place, they have
Not
to wear
well
something that
proportioned.
suddenly they want to have some
Yeah.
showmanship.
Yes.
So, where is that line, the Father?
Okay, first, don't forget two guidelines. Generally, will it really contribute to the well-being of your person? If it is, go ahead. Drooping eyes, go ahead.
Eye bags even.
Eye bags.
Wrinkles.
You look
But
older. You look older.
I have some reservations with Botox.
Yeah.
Because it's a poison. Try to enhance your eyes. I have also some reservations with Chinese who would like to have bigger
Eyes.
eyes, no?
Or eye folds.
Oh. Because that is their uniqueness. You were created for that. It is something unique and you are beautiful. It's only those, or probably your own speculation, that you are not beautiful. Oh my God, all of us are beautiful.
But Father, let me interrupt. Isn't it that if the patient feels they're not beautiful when they look at the mirror, isn't it a reason for them to seek consult to us
Yes.
for part
Yes,
of what we call to
yes.
become socially accepted? Because as we have mentioned, beauty is within, is within, and everybody's beautiful from within. But physically, we have to also be,
I'll agree with that, but even before they can go to the plastic surgeon, they can go to a psychologist first.
Or
And
vice
probably-
versa. You know.
Or probably try to get some ideas there. That in fact you probably do not need it. And afterwards, if they're still very, very dissatisfied, go ahead. There's nothing wrong with going to you and you recommending that we can do this, but up to this extent, expectations should never be too high because it might even be a source of lawsuit.
exactly.
And it's very bad for doctors to go to be hurled into court. Very bad.
That's why
And
they
as a
have
matter
the
of fact-
informed consent. That's why they're telling them you should not expect too much. You know,
That's
or,
right. That's right. That's why a doctor must have some ethical direction. If there is none, just go on, and on. And afterwards, they find themselves in court. Whether they win or not, they lose.
So,
All right.
Doctor, is the first orientation for a plastic surgeon to dissuade a patient from a procedure?
off the record, I should think not, because that is their livelihood also, and that is their specialty. They know what to do with a person.
I agree,
Yes,
Dr.
I'm just trying to clarify the question in my mind, but I'm not taking any sides.
It's not really to dissuade patients, but rather we need to understand what their needs
The
are.
reason is.
Now, if there is a basis for that, then we venture further. But if there's no basis for it, if they're not realistic with what they want to happen to their body, to this face, whatever, then we have to shift gears, which means that's already a red alert for us.
I see.
Right.
I see.
right. I would like also to go to that issue. It means, well, some people say, this is my life, this is my body.
Yes, yes.
My money,
It
or
is
my
my money.
husband's money.
Remember that no one lives in an island.
Yeah.
You are always connected with anyone else. Whatever happens to you, everyone is affected. For example, if you go through a transgender surgery, you're not the only ones affected. Everybody around you is affected. Okay? If you have that a wound that doesn't heal after the sexual surgery, everybody is affected. Simple. You stay long in the CR while the others are lying and lining for you. You stay long.
Waiting for you to finish your
Isn't it?
process.
To finish the cleaning and the putting the lactacid, all of this so that it doesn't stink.
With the male, this is a male
Yeah, the
patient,
male
Father.
going into transgender surgery. You see? It's not only you who will be affected, everyone else.
Okay, well, we've run out of time for this particular segment. So may I ask a few, parting words from each of the panel members? Attorney Sarah.
Okay, I'll start. Well, in the Catholic faith, vanity is a sin. Ano? Pero surgery is not. So it depends if you need it or if you want it. So long as it does not make you vain and you worship yourself, then I would say I'm for aesthetic or plastic surgery.
Okay, Dr. Sanchez, anything you wish to say before we say goodbye?
Yeah, I don't know. Father, is it really vanity? Is it a sin, rather, from the Catholic point of view?
Any obsession, an attitude in which you want to be beautiful in order to be admired, is vanity.
It's to be admired, of course.
Okay? It is selfishness. Selfie. Dito ka tumingin sa akin, maganda ako.
Well, Father, we will have to leave that for another episode. Okay. Dr. C.
Yes, for our potential clients, I think the best thing to do is do your homework. Check the credentials. Who are the doctors? Who will do the procedure for you?
Okay, thank you so much, Doctor. What I can gather from today's discussion is that the ethical issues surrounding plastic surgery have actually become more complex. So therefore, we probably should have a continuing forum among doctors, bioethicists, maybe even the government and the general public to have a more discerning examination of each of these questions. Ultimately, we not be able to answer all of them, but at least we will be able to enhance the protection of the interests of all the stakeholders in the industry. Thank you for joining us today on Medical Dilemma. If you have questions, comments, or suggestions, please email them to heavenlycrestproductions@gmail.com, and we will try to respond to all of them as much as we can. Okay, tune in once again next Sunday, 6 p.m. here on GNN for another engaging discussion on Medical Dilemma, because you may have been or are or could be patients. Okay, help patients and families in crisis. Be aware and show you care. May you have an enlightened week ahead. Thank you and goodbye. Thank you so much, Doctor.
Medical Dilemma